In hypertension, the blood pressure is below normal, normal, above normal, fluctuating. The correct answer is option C, above normal. Hypertension is defined as persistent elevation of blood pressure above 140 by 90 mm of Hg. The normal heart rate is in adult is 50 beats per minute, 60 to 100 beats per minute, 100 to 120 beats per minute, 40 to 60 beats per minute. The correct answer is option B, 60 to 100 beats per minute. Normal adult pulse rate is between 60 to 100 beats per minute. The main symptom of myocardial infarction is headache, chest pain radiating to left arm, abdominal pain, fever. The correct answer is option B, chest pain radiating to left arm. Myocardial infarction causes severe chest pain radiating to the left arm, jaw, or back due to lack of oxygen to heart muscle. The drug used to relieve chest pain in angina pectoris is insulin, nitroglycerin, furosemide, diazepam. The correct answer is option B, nitroglycerin. Nitroglycerin dilates coronary arteries, improving blood supply to heart muscle. The normal respiratory rate for adult is 8 to 10 breaths per minute, 12 to 20 breaths per minute, 25 to 30 breaths per minute, 40 to 50 breaths per minute. The correct answer is option B, 12 to 20 breaths per minute. 12 to 20 breaths per minute is normal in adult. Inflammation of the liver is known as nephritis, hepatitis, gastritis, cystitis. The correct answer is option B, hepatitis. Hepat means liver, itis means inflammation, together called hepatitis. The main cause of peptic ulcer is excess food, Helicobacter pylori infection, lack of vitamins, alcohol only. The correct answer is option B, Helicobacter pylori infection. H. pylori infection and stress increases acid production leading to ulcer. Which electrolyte imbalance occurs in diarrhea? Hyperkalemia, hypokalemia, hypernatremia, hypocalcemia. The correct answer is option B, hypokalemia. Potassium is lost in diarrhea that leads to hypokalemia. The first heart sound lub is caused by closure of semilunar valves, AV valves, aortic valves, pulmonary valves. The correct answer is option B, AV valves, arterioventricular valves. Closure of mitral valve and tricuspid valve, AV valves, causes the lub sound. In burns, the rule of 9 is used to measure depth, estimate body surface area burn, measure pain, identify infection. The correct answer is option B, estimate body surface area burned. Rule of 9 helps estimate percentage of total body surface area affected by burns. The common symptom of appendicitis is left abdominal pain, right lower abdominal pain, upper abdominal pain, back pain. The correct answer is option B, right lower abdominal pain. Pain start around umbilicus and shift to right lower corner, we call MC Burner's point. The main symptom of diabetes mellitus is weight gain, polyuria, polydipsia, polyphagia, fever, cough. The correct answer is option B, polyuria, polydipsia, polyphagia. Classic trait of diabetes, excessive urination, thirst and hunger. Insulin is secreted by alpha cells of pancreas, beta cells of pancreas, adrenal gland, thyroid gland. The correct answer is option B, beta cells of pancreas. Beta cells of islets of Langerhans secrete insulin. The main symptom of anemia is blue skin, yellow eyes, pallor and fatigue, rash. The correct answer is option C, pallor and fatigue. Low hemoglobin causes less oxygen intake, that causes pale skin and tiredness. The main symptom of anemia is blue skin, yellow eyes, pallor and fatigue, rash. The correct answer is option C, pallor and fatigue. Low hemoglobin causes less oxygen levels, that leads to pale skin and tiredness. The instrument used to measure BP is stethoscope, thermometer, sphygmomanometer, ECG. The correct answer is option C. The normal range of hemoglobin in adult male is 8 to 10 grams per deciliter, 10 to 12 grams per deciliter, 13 to 16 grams per deciliter, 17 to 20 grams per deciliter. The correct answer is option C, 13 to 16 grams per deciliter. The average hemoglobin level in adult male is 13 to 16 grams per deciliter, in females is 12 to 14 grams per deciliter. The main symptom of pneumonia is constipation, cough with sputum and fever, headache, leg pain. The correct answer is cough with sputum and fever. Pneumonia is an infection of lungs causing fever, productive cough and breathlessness. The causative organism of tuberculosis is Streptococcus, Mycobacterium tuberculosis, Staphylococcus aureus, E. coli. The correct answer is option B, Mycobacterium tuberculosis. Mycobacterium tuberculosis infects the lungs and other organs. The sputum test is done to diagnose heart disease, tuberculosis, liver disease, anemia. The correct answer is option B, tuberculosis. Sputum examination detects acid for bacilli or for TB diagnosis. Pulse oximeter measures option A blood pressure, oxygen saturation, heart rate only, temperature. The correct answer is option B oxygen saturation. A pulse oximeter measures the oxygen saturation in the blood. Normal oxygen saturation in healthy adult is 70 to 80%, 85 to 90%, 95 to 100%, 60 to 70%. The correct answer is option C 95 to 100%. Saturation between 95 to 100% indicate adequate oxygenation. The main sign of hypoxia. Cyanosis, bluish discoloration of lips, red face, sweating, fever. The correct answer is option A. Cyanosis, bluish color of lips. Cyanosis occurs when oxygen in blood is low, giving skin a bluish color. The bed position for a patient with breathing difficulties: supine position, fowler's position, prone position, Trendle, Trendelenburg position. The correct answer is option B, fowler's position. Fowler position or sitting up eases lung expansion and breathing. The organ affected in jaundice is kidney, liver, lung, heart. The correct answer is option B, liver. Jaundice occurs due to increased. The organ affected in jaundice is kidney, liver, lung, heart. The correct answer is option B, liver. Jaundice occurs due to increased bilirubin. The organ affected in jaundice is kidney, liver, lung, heart. The correct answer is option B, liver. Jaundice occurs due to increased bilirubin from liver dysfunction. The yellow color in jaundice is due to option A, hemoglobin, bilirubin, melanin, cholesterol. The correct answer is option B, bilirubin. Excessive bilirubin in blood leads to yellow discoloration of skin and eyes. The main symptom of renal failure is increased urine output, decreased urine output, fever, sweating. The correct answer is option B, decreased urine output. In renal failure, the kidney cannot filter waste, leading to reduced urine. The most common symptom of urinary tract infection is E. coli, Staphylococcus, Klebsiella, Pseudomonas. The correct answer is option A, E. coli. E. coli from intestinal tract commonly causes UTI, especially in females. The main symptom of cystitis is headache, burning sensation during urination, cough, vomiting. The correct answer is option B, burning sensation during urination. Cystitis, inflammation of the urinary bladder, causes burning and frequency. Dialysis is used to treat heart diseases, kidney failure, liver cirrhosis, lung infection. The correct answer is option B, kidney failure. Dialysis removes waste and excessive fluid when kidney fail to function. The main symptom of heart failure is chest pain, swelling of feet, rash, headache. The correct answer is option B, swelling of feet. The main symptom of heart failure is chest pain, swelling of feet, rash, headache. The correct answer is option B, swelling of feet. Heart failure causes fluid accumulation leading to pedal edema. The pacemaker of the heart is AV node, SA node, Purkinje fibers, bundle of his. The correct answer is option B, SA node. SA node, sinoatrial node, initiate heartbeat. ECG is used to record blood pressure, heart electrical activity, brain waves, lung function. The correct answer is option B, heart electrical activity. ECG records electrical impulses of heart to detect arrhythmia or myocardial infarction. The normal respiration ratio of inspiration expiration is 1:1, 1:2, 2:1, 1:3. The correct answer is option B, 1:2. Expiration is normally twice as long as inspiration. The main symptom of asthma is option A, chest pain, wheezing sound and breathlessness, fever, cough only. The correct answer option B, wheezing sound and breathlessness. Asthma causes airway constriction, wheezing and shortness of breath. The first aid for nose bleeding epistaxis is tilt head backward, tilt head forward, lie down flat, apply ice to neck. The correct answer is option B. Leaning forward prevents blood aspiration into lungs. The common symptom of dehydration is excess saliva, dry mouth and sunken eyes, diarrhea, cough. The correct answer is option B, dry mouth and sunken eyes. Dehydration leads to fluid loss causing dry tongue, low BP and sunken eyes. The normal serum sodium levels is 100 to 120 milliequivalent per liter, 135 to 145 milliequivalent per liter, 150 to 160 milliequivalent per liter, 200 milliequivalent per liter. The correct answer is option B, 135 to 145 milliequivalent per liter. Sodium helps maintain fluid balance. Normal range is 135 to 145 milliequivalent per liter. Deficiency of insulin causes hypertension, diabetes mellitus, hypertension, anemia. The correct answer is option B, diabetes mellitus. Insulin deficiency leads to high blood sugar levels, that is diabetes mellitus. The hormone secreted by thyroid gland is insulin, thyroxine, adrenaline, estrogen. The correct answer is option B, thyroxine. Thyroxine controls metabolism and growth. Enlargement of thyroid gland is called goiter, cretinism, myxedema, hypothyroidism. The correct answer is option A, goiter. Iodine deficiency leads to enlargement of thyroid gland, goiter. The main symptom of hypothyroidism is weight gain, weight loss and restlessness, edema, fatigue only. The correct answer is option B, weight loss and restlessness. Overproduction of thyroxine increases metabolism, causing weight loss. The cause of tetany is deficiency of option A, calcium, option B, sodium, option C, iron, option D, potassium. The correct answer is option A, calcium. Low calcium level causes muscle spasms and convulsions, tetany. The common site for pulse checking during CPR is radial, carotid, femoral, brachial. The correct answer is option B, carotid. Carotid pulse is strong and easily felt during resuscitation. The most common symptom of meningitis is headache and neck stiffness, diarrhea, chest pain, rash. The correct answer is option A, headache and neck stiffness. Meningitis causes inflammation of meninges, leading to severe headache and stiffness. The causative organism of malaria is virus, plasmodium, bacteria, fungus. The correct answer is option B, plasmodium. Malaria is caused by plasmodium parasite transmitted by Anopheles mosquito. The vector for malaria is Culex mosquito, Aedes mosquito, Anopheles mosquito, sandfly. The correct answer is option B, female Anopheles mosquito transmits malaria. The incubation period of malaria is 1 to 2 days, 10 to 14 days, 20 to 25 days, 30 days. The correct answer is option B, 10 to 14 days. Malaria symptoms appear after 10 to 14 days of infection. The main symptom of dengue fever is joint pain and high fever, cough, diarrhea, skin rash only. The correct answer is option A, joint pain and high fever. Dengue causes severe muscle and joint pain called breakbone fever. The mosquito responsible for dengue is Anopheles Aedes aegypti, Culex sandfly. The correct answer is option B. Dengue is spread by the Aedes aegypti mosquito. The main symptom of typhoid fever is high fever with stepladder pattern, rash, vomiting, cold. The correct answer is option A, high fever with stepladder pattern. Typhoid shows stepwise rising fever caused by Salmonella typhi. Thank you all.